Medical news from MedRxiv. Dissecting the genetic architecture of knee alignment reveals its contribution to osteoarthritis risk. Varus, or inward-bowed, knee alignment dramatically raises the odds of painful knee disease, with individuals whose knees point outward facing more than 3 times the risk of needing a total knee replacement. By linking detailed imaging, genetic mapping, and causal inference, the new study clarifies how the shape of the lower limb both reflects and influences the development of osteoarthritis, while showing that the relationship is more complex than a simple one-way cause-effect. Knee osteoarthritis is a leading source of disability worldwide, affecting roughly 1 in 4 adults over 60 and accounting for a substantial share of chronic pain and joint replacement surgery. Although malalignment of the knee joint has long been recognized as a biomechanical risk factor, the underlying biological mechanisms and the directionality of the association have remained uncertain. Existing epidemiologic work has been limited by modest sample sizes and reliance on clinical rather than imaging-derived measures, leaving a gap in understanding whether alignment is a driver of disease, a consequence of early joint degeneration, or both. The investigators leveraged the UK Biobank, a population-scale resource that includes dual-energy X-ray absorptiometry (DXA) scans for tens of thousands of participants. Using a validated machine learning pipeline, they extracted the femorotibial angle, a quantitative metric of knee alignment, from the DXA images and calculated each individual's mean angle across repeated measures. They then related this metric to incident knee pain, radiographic knee osteoarthritis, and the occurrence of total knee replacement, employing Cox proportional hazards models adjusted for age, sex, body mass index, and other covariates. In parallel, a genome-wide association study, GWAS, of the mean femorotibial angle identified genetic loci linked to alignment, followed by fine mapping, pathway enrichment, and expression quantitative trait locus (EQTL) analyses in fetal and adult joint tissues. Finally, the team applied 2-sample Mendelian randomization (MR) to test for causal relationships between genetically predicted alignment and osteoarthritis outcomes, and vice versa. Across the imaging cohort, each degree of Varus deviation was associated with a stepwise increase in knee pain and radiographic osteoarthritis, culminating in a hazard ratio of 3.42, 95% CI 2.92 to 4.02, for total knee replacement among participants with pronounced varus alignment. By contrast, the same alignment metric showed no meaningful association with hip osteoarthritis, underscoring a joint-specific effect. The GWAS uncovered 20 independent loci reaching genome-wide significance, p less than 5 times 10, that collectively explained a modest but appreciable fraction of alignment variance. Enrichment analyses highlighted pathways involved in skeletal development, cartilage homeostasis, and endochondral ossification, suggesting that the genetic determinants of alignment act early in joint formation and persist into adulthood. EQTL mapping revealed that many of the associated variants modulate gene expression in both fetal growth plates and adult cartilage, reinforcing a life course perspective. Genetic correlation analysis demonstrated a shared polygenic architecture between femorotibial angle and knee osteoarthritis, indicating that the same genetic factors partly drive both traits. In the MR framework, a higher genetic liability to knee osteoarthritis was found to modestly reduce the femorotibial angle, beta equals 0.11, 95% CI 0.16 to 0.06, implying that early joint degeneration may subtly shift alignment toward varus. Conversely, the reverse direction, genetically predicted varus alignment increasing osteoarthritis risk, yielded an odds ratio of 0.93, 95%. Thank you for watching. For the full article visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.